Okay, next one I'm going to talk about the Supreme LMAs, which is, as the name suggests, it is more supreme than that of the eye gel. So let's have a look at the parts of it. So this is the Supreme eye gel. So when you open it from a packet, it comes in a cradle. So you make sure you take this off. So that's a cradle. So same as the eye gel, it's got a cuff, but this is an inflatable cuff, and you have a pilot balloon here. The sizing, it's always written onto the, if you look closer, it's always written onto the tubing that what size is needed. So this is a size 5, which is ideal for 70 to 100 kilogram male or female, depends upon the weight. It is more curved, so it follows the upper airway anatomy more well. So it gets and sits on the glottis really well. It's got a bite block, which the upper incisors and the lower incisors correspond, and it has a stabilizing system which you can put the tape and put them onto the place. So that's for helping to put the tie on. It has got a port where you give the oxygen, and this one is for giving nasogastric feed. So it's basically, it's like it's a combination of two tubes. So one is for oxygen, and the smaller one is for giving nasogastric drainage or nasogastric aspirate. Okay, let's see how we insert this. So this is the LMA, the Supreme LMA. So I'm just going to insert this into my patient. So imagining the patient has been pre-oxygenated, he's ready to have this LMA in. Now, before you insert it, you have to deflate the cuff, but making sure that the shape is consistent as you see like here. Okay, so I'm going to deflate it now. So basically, you have to put a syringe at the end, and then you just deflate. When you deflate it, make sure that all the edges of the cuff is of equal consistency. So you can see that it's getting nicely deflated. Okay, so I'm just going to take more air from the cuff. Okay, so that's pretty much deflated really well, and you can see that there is some sort of air left in there, so that what happens is it's not going to get stuck with the arytenoid cartilage. So if I just show the anatomy one more time here, so that's the arytenoid cartilage where your LMA might get and stuck there, which you may not be able to pass them easily. So that's why I have deflated really well, and I apply some lubricant. So always I apply the lube on the posterior cuff. So this is the posterior cuff, and that's the anterior cuff. So I put the cuff on the posterior aspect. Okay, making sure that I've got equal consistency of the lube, the lubricant, and then I'm going to insert it to my patient. So I have my patient here. So hold it by the bite block. Do a head tilt and chin lift. If you have an assistant, it's really good if they can open the mouth. So, but because I'm all by myself here, I'm just going to do a head tilt and chin lift. Hold the mask with my dominant hand. So same way as we put all the LMAs, follow the natural curvature of your anatomy. So you start like that and you go like that. Okay, so I'm starting behind the upper incisors, inserting it unless I don't feel any give or I start to feel huge resistance. I can do a further head tilt and chin lift, and I can insert it further. Okay, so that tube is in place, and you can see that the bite block is corresponding to the upper incisors. So I'll inflate the cuff now. So each LMA has got how much of air needs to be inflated. So it's actually written on the package. So that's the easy way of remembering it. It's written on the package that how much of air is required. I'm going to attach this to my oxygenation device, And let's have a look at the lungs now. Okay, so that is good air entry on both sides. I can see visible rise and fall of the chest. Also, I'll make sure that I can hear air entry on both sides. So I'll just do auscultation. Mid-axillary line bilaterally. Okay, and once I have the tube placement is confirmed, I can insert a nasogastric. So if you can zoom over here please, so that's a nasogastric port. So we will insert a nasogastric port through there. And to secure the tube, it's quite easy. So you do from maxilla to maxilla, just put a tape. That's all you need to do. So I'll just put a tape. My tube is in place. I keep ventilating my patient. All right, thank you.